All right, this is SDG assignment 3, and I did it on Sustainable Development Goal 3 in America by Austin Andrews. So, the data story, according to Our World in Data, the United States has been a leader in adults with obesity from 1975 to 2016 based on general population surveys, and that's out of the entire world that they gathered all the data on. Um, the classification of obesity is defined by having a BMI of 25 or greater. Uh, and then some of the closely following countries are Australia, the UK, and Brazil with the highest percentages, and their percentages ranged from 30 to 22%. And I'll see on the next page the table. All right, so here you can see that Australia, UK, and Brazil are not too far off from the United States, but there's definitely a huge gap between Brazil to Nigeria. And so the percentage of obese people has steadily risen from 1975 to 2016, uh, more rapidly for the four leading countries, uh, while the rest of the countries on the chart have risen much less over time in comparison. So, according to Our World in Data, the number of deaths related to drug use has also risen dramatically, which is from 2000 to 2019. Specifically, opioid deaths, which have risen from 8,000 to about 55,000 in the US, and they have been the leading cause of drug deaths from 2000 to 2019, beating drugs like amphetamines and cocaine by about 50,000 deaths as of 2019. And the when I say leading cause of death, I don't mean out of all conditions, including like obesity and things like that. I just mean out of the drugs, opioids have been the leader in that. And then you can see on the chart from Our World in Data just how dramatically opioid use has risen from 2010 all the way up until 2019. From around 2005 to 2000, we could see it was a slight increase, and then sometime in the 2010s, it just began to increase rapidly, and that could be maybe a effect of the dark web and things like that becoming more popular, and then fentanyl starting to rise. All right, so here's some solutions I have for obesity and drug use that can help contribute to SDG 3 in America. So, telemedicine and virtual health coaching. So, by expanding access to telemedicine services and virtual health coaching programs that provide remote consultations with healthcare professionals and nutritionists, it could help expand education on healthy eating habits, and this could enable individuals to receive personalized guidance and support for managing their weight and adopting healthier habit. So, I know it's already popular for like Zoom doctors after COVID and everything like that, but more of an emphasis on just virtual health coaching, I think, could definitely make a large impact, especially in America. So, some more solutions for Sustainable Development Goal 3. So, AI based solutions, which is basically AI based predictive analysis models, can identify individuals at high risk of developing issues like obesity, diabetes, or cardiovascular disease before symptoms are noticeable. And then something like precision medicine and pharmacogenomics could identify genetic, metabolic, and behavioral factors that influence individual responses to diet, exercise, and pharmacological treatments for obesity. And I feel like this could also be used when it comes to drug use for prescribing drugs and things like that. All right, and these solutions are more focused on opioids and other drugs. So, smart pill dispensers. So, developing a smart pill dispenser technology equipped with sensors, reminders, and tracking features to help individuals manage their medications safely and prevent misuse. And then, opioid overdose detection devices, which could be something like wearable sensors and smart devices that are cheap and capable of detecting signs of opioid overdose, such as respiratory depression or increased heart rate in real time. And these devices can trigger automatic alerts to emergency services, allowing for timely interventions.